A woman woke up with jaw pain at 22. 3 years later, her face looked different. This is what was growing inside her brain. AS is a 22-year-old woman presenting with jaw pain. I'm Dr. Rachel Rayan, and this is Medical Detective. Before we follow AS into the hospital, you need to know who she was, because the cruelty of this case is not just what happened to her body. It is what it was taken from. Annie Sidoric was a 3-varsity sport athlete in high school. She was fit, active, and healthy her entire life. She was in her senior year of college when COVID hit, finishing her degree, planning her future. She was, in every way, the picture of a healthy young American woman. And in March 2020, she woke up with jaw pain. Her jaw was minus, quote, popping and popping and popping. She went to a dentist. The dentist said TMJ disorder caused by stress from grinding her teeth during the pandemic. A procedure under anesthesia was done to manipulate her jaw back into position. It worked for 2 weeks. Then her jaw popped out again. A second procedure was done, still not fixed. The jaw pain never stopped. Then she stopped getting her period. For a 22-year-old 3-sport athlete who had always been regular, this was alarming. She went to her gynecologist. The doctor said it was from exercising too much. This made no sense. She had been training at this level since high school. The doctor ordered blood tests showing low estrogen. She was prescribed hormones to restart her cycle. It did not work. The doctor told her to wait and see. Then something she could not explain, something she could not dismiss. She moved to New York City after college, and she began to notice her face was changing, not dramatically, not overnight, but undeniably. Her jaw was getting broader, her lips were becoming puffier, her features were becoming slightly coarser, and then her fingers, they began to swell gradually, every day slightly more, until one morning, the gold ring that had belonged to her grandmother, a ring she had worn every single day for years, split apart on her finger. It could no longer contain her hand. Doctor after doctor, wrong answer after wrong answer. One doctor said her hip pain, which had now also appeared, was a twisted pelvis. Another said the pain was, quote, just in her head. She received nerve blocker injections through her vagina for pelvic pain. She went through physical therapy for leg pain. An oral surgeon suggested, quote, breaking her jaw and putting it back in place. 3 years. Disparate symptoms accumulating. A body visibly changing. And the universal medical explanation for all of it. Stress. Always stress. In 2022, Annie found a doctor who did something none of the others had done. Dr. Prusmack did not focus on any single symptom. She looked at everything, all of it together. The jaw, the face changing, the loss period, the swelling hands, the hip pain, the growth. And she ordered one specific blood test checking for a hormone called IGF-1. Insulin-like growth factor 1, the marker for growth hormone in the body, and the result came back. And it was, according to her endocrinologist, substantially elevated. So elevated that Dr. Prusmack called Annie on a Zoom call to give her the news personally, then an MRI of her brain. And there it was, on her pituitary gland, a small tumor sitting silently in the center of her skull, growing, producing growth hormone every single hour of every single day for 3 years. A pituitary adenoma, this tiny mass, no bigger than a pea, had been reshaping Annie Sidoric's face, hands, jaw, and body 1 fraction of a millimeter at a time, while every doctor she saw looked everywhere except the place it was hiding. Now here is the science, and I want you to pay close attention because what you are about to learn will change how you think about your own body forever. Your pituitary gland, a structure the size of a pea sitting at the base of your brain, is called the master gland, and it earns that name. It controls the production of growth hormone, thyroid hormone, cortisol, reproductive hormones, and more. It is the conductor of your entire endocrine orchestra. When it works correctly, you never think about it. When a tumor grows on it, even a tiny benign one, it begins producing hormones in quantities the body was never designed to handle. In Annie's case, the tumor was overproducing growth hormone. In children, excess growth hormone causes gigantism. The body grows too tall. But in adults whose bones have already fused, the excess growth hormone cannot make you taller. Instead, it affects the softer parts. The jaw grows, the hands grow, the feet grow, the facial features coarsen, and the organs can enlarge. This condition is called acromegaly. It develops so slowly, usually over years, that patients and even their own families often do not notice the changes happening right in front of them. By the time symptoms are obvious, the disease has usually been progressing for 7 to 12 years. Here is the key mechanism, and this is the part I want you to remember. IGF-1 insulin-like growth factor 1 is produced by the liver in response to growth hormone signals from the pituitary. Think of it as the messenger. When the pituitary tumor sends too many messages, the liver produces too much IGF-1, and IGF-1 tells every tissue in the body to grow, not just bones, every tissue, joints, organs, skin, the jaw, the hands, the face, slowly, persistently, unstoppably, until someone measures the IGF-1 level in the blood and sees the number that should have been checked years earlier. Annie was diagnosed with a pituitary adenoma causing acromegaly. Surgery was performed to remove the tumor. Her jaw pain improved, her swelling decreased, her hormones began to normalize. She was recovering, but just before the Washington Post published her story in December 2025, Annie received news that the tumor was growing back. She is now working with her endocrinologist on a treatment plan that may include surgery, again, lifelong medication or radiation. She shared her story, despite the tumor returning specifically so that other Americans would recognize the signs before 3 years pass. Here is what every American watching this needs to know right now. Acromegaly affects approximately 60 in every million Americans. Most go undiagnosed for 7 to 12 years. The warning signs to watch for, especially if multiple symptoms are present simultaneously, are jaw pain or jaw growth, hands or feet slowly increasing in size, facial features coarsening or broadening over time, loss of menstrual periods in women, and unexplained headaches. If you or anyone you know has these symptoms and has been told it is just stress pushback, ask specifically for an IGF-1 blood test. This single blood test is what finally gave Annie her answer. Now, drop a comment right now. Has anyone ever dismissed your symptoms as just stress when your instinct told you something was genuinely wrong? Drop yes or no because Annie was right to push back. And if your comment helps one person push back too, it matters. I read every single one. And if Annie's story, 3 years, a face that changed, a ring that snapped, and a brain tumor nobody looked for, moved you today, subscribe to Dr. Rachel Rayan. New case every single day. Real, documented, American, and always something that makes you see your body and your health completely differently. I will see you tomorrow.